over time, almost everyone will develop joint pain for one reason or another. And the most common reason is that the joint is somehow malaligned, or there's been some injury to the support structures of the joint, and now you've got some pain. Rheumatoid arthritis pain is a little bit different from that because it's caused by inflammation of the joint, and that has a different characteristic than the everyday joint pain that most people have. Rheumatoid arthritis is an autoimmune disease, which means that the immune system, which is supposed to be your protection against viruses or bacteria, becomes active against your own tissues. And in rheumatoid arthritis, these are the joint tissues. So it causes inflammation, pain, and swelling, especially in the joints of the hands. So it can affect the nearer of the knuckles. It can affect the wrists, the elbows, shoulders, hips, knees, many of the joints of the body, but usually the smaller, medium-sized joints. And so, along with the joint pain caused by RA, patients tend to have systemic symptoms. And again, this is because the immune system is active. So it's similar to when you've got a cold or a flu. If the immune system is active, you've got some fatigue, maybe low-grade fevers. You sort of feel like you're ill. And RA joint pain tends to be symmetrical. So if it affects one or two joints on one side of the body, it tends to affect the same joints on the other side of the body. We would almost rule out someone who has maybe one or two joints affected. So we're really looking for multiple joints, symmetric on both sides of the body. Rheumatoid arthritis is most common in women who are in their 30s or 40s, sometimes 50s, and they tend to come on a little slowly. So maybe you'll have one joint that hurts and then another and another. It comes on over a period of weeks to months. But by the time it's very active, it's quite noticeable. A lot of times, busy adults who are otherwise in control of their lives like to just push through the pain and soldier through. And with rheumatoid arthritis, that could delay diagnosis and it could lead to more trouble in the future. And that's because the inflammation doesn't just cause pain, it also causes damage to the joint structures and to the bone. Before we had state-of-the-art therapies, patients would end up with deformities and be unable to use their joints at all. And we can protect against that if we control the inflammation to the best of our ability. It's a chronic condition, but it can be managed quite well. And we have a number of new drugs, which are exciting. So most patients can achieve a remission or a partial remission.